This looks too easy to matter. 30 seconds of seated calf raises, done at your desk, may do more for your blood sugar and back than most people get from a full workout. Let us understand why this small movement works, and how often to do it. A seated calf raise is not just working your calves, it is targeting a deeper muscle called the soleus, and it behaves differently from almost every other muscle in the body. While most muscles burn through fuel quickly and fatigue fast, the soleus is built for hours of quiet, continuous work. It is packed with slow-twitch fibers that run on blood sugar and fat rather than stored glycogen. Because of that, it can keep working quietly for hours without fatiguing, which is exactly what desk workers need from a muscle they never think about. The soleus just needs to keep moving, and as long as it does, it keeps working, keeps burning, and keeps pulling glucose out of the bloodstream. Researchers at the University of Houston discovered that the soleus muscle can shape how the whole body handles blood sugar after eating. In their study, people who did a seated heel raise movement called the soleus push-up while sitting showed 52% lower blood sugar after a meal and 60% less insulin demand compared to the control group. The soleus was pulling sugar out of the bloodstream and burning it for hours, all while the participants remained seated. That is a remarkable result from a movement that requires no equipment, no standing up, and no change to your normal workday. When you sit for hours, blood pools in the legs, the calves stiffen, and the lower back starts compensating for muscles that are no longer doing their job. The soleus acts as a peripheral heart. Every time it contracts, it pushes blood back up from the legs toward the heart, keeping circulation moving without you standing up or walking anywhere. Seated calf raises keep that pump working through the day. Less pooling in the legs means less stiffness in the pelvis, less tension in the lower back, and less effort every time you stand up from your chair. For most desk workers, a practical starting point is 10 to 20 reps of seated calf raises every hour of sitting, repeated 3 to 6 times across the day. Keep the pace smooth and controlled, about 1 rep per second. If you are more active already, move to 2 to 3 sets of 15 to 25 reps spaced throughout the day. If you have Achilles or calf sensitivity, start with 8 to 12 reps once or twice a day and build gradually from there. The goal is 2 to 4 minutes of light calf movement per day, spread across several short bouts rather than one single session. Little and often is what the research supports. If you sit for most of the day and deal with a stiff back, heavy legs, or blood sugar spikes after meals, this is one of the smallest changes you can make with a meaningful return. 30 seconds of seated calf raises, repeated a few times a day, keeps the soleus working, the circulation moving, and the blood sugar more stable after eating. No equipment, no standing up, no change to your workday, just a small movement that compounds quietly over time. Train smarter, not harder. Thanks for watching.